When Danny asked me to do this talk a couple of months ago, I wasn't sure if it was because I had so much expertise in this area as it was because of my age. And I know that I gave some talks like this about 20 or 25 years ago when Parenting University first started. And Kathy, you might remember that, let's see, who was it that helped put that together? She works at Children's now. Peggy, yeah, Peggy put together Parenting University. And I gave one of those talks. And when I was telling my nurses in the office that I gave these talks 20 or 25 years ago, they said, "You mean a quarter of a century?" So, but anyway, I do also recall that, you know, back at that time when I was a young doctor and parents would come in, and even nowadays when parents come in, and they will say things like, "My mom and dad told me teething can cause high fever," or "high fever can cause brain damage, and therefore teething can cause brain damage too, can't it?" Now that's kind of funny, I know. But of course, what's the treatment for teething? Whiskey on the gums. So these are the kind of things that we as grandparents do not want to be saying to our kids, because all those things are, of course, not true. And now that I am a grandparent, you know, I find that it's harder and harder to keep up with things, and with all the new changes in medical advice and knowledge. And yet, I don't want to become irrelevant, unknowledgeable, and not up to date. And that's part of why we're going to do these classes, I think. So as I was trying to get up to date for the subject matter tonight and was doing some research for this, I kind of came across two categories of grandparents that might be interested in this talk. One is the grandparent who occasionally sees their grandkids, you know, on the weekends and holidays and occasional sleepover. The other is the grandparent who might have grandkids living in their house. And I'm in that latter category. And my oldest granddaughter and daughter have lived in my house for the last 2.5 years, and so I do have, I think, some firsthand experience in the tough role of being a grandparent, but yet having to do other things besides be a grandparent. So, but I also was wondering, you know, how many grandparents are actually in that situation? How many grandparents are out there that have to help raise their own grandkids? So, in my research, I found, first of all, that the Pew Research Center found that 40% of all U.S. children live with one or more grandparents at some time in their life. That's almost half of all of our kids born today will be raised by us at some point or another. And according to the American Academy of Child and Adolescent Psychiatry, over the last decade, this trend is going just way up. And what are the factors? One is increased numbers of single-parent families, the high divorce rate, teen pregnancy, substance abuse by parents, deployment of one or both parents with the military, illness, death, or disability of parents, parental abuse or neglect, and then lastly, just this poor economy and job loss. 50% of these kids who move in with their grandparents move in as infants or toddlers and remain on average 5 years. So grandparents, we as grandparents are the safety net for our grandkids. And it often happens at the very time in our lives when we want to be slowing down, when we want to enjoy the fruits of our labor, we want to enjoy the remaining funds that we've saved up for retirement before they're completely gone. And sometimes there can be feelings of grief, anger, loss, and resentment. And you hate to have those kind of feelings, but nonetheless they're there. And the emotional and financial burden on us can be very, very significant. And I just want to read a couple of paragraphs from this article that I was just quoting from. Many grandparents in this new caretaking role underestimate or are unaware of the added burdens that their new role as parents will place upon them. Grandparents often assume that their role will be to nurture and reward and play with their grandchildren without having to set limits. But when grandparents serve as the primary caregivers, they must learn to set limits. They must learn to discipline just as they did when they were parents themselves. Sounds kind of bleak, but it's not always that bad. Caring for your grandchildren can also be a very rewarding and positive experience. We bring the benefit of years of experience and perspective, and we hopefully also bring stability and predictability to our grandkids. So it's with that kind of background that we are launching this Grandparenting University. It's the first time we've done this, and we picked a few topics that we thought might be important, but I would also appreciate any kind of questions from you at the end of this and any thoughts on future topics that we could add to this. Okay, so let's get to the technology here. So, back in the 1980s, it's when I was first starting practice, and things were like this. They are not like that today, and today we're more like this. High-tech everything, and we've got to keep up with things. And the first thing I want to talk about is a subject that's always dear to pediatricians, and that is vaccinations. Back in 1980, we had a total of 7 shots that we gave kids between birth and when they went off to college. We now have 24 shots that we give to kids. And just as an example, this vaccine right here, diphtheria, tetanus, and pertussis. That DPT vaccine has been around since 1980, and now that vaccine is still around, but there's a new and improved version that we give to kids at 11 and 12 years of age that protects them against whooping cough. And each of us in this room, if we care for our grandkids, should get that vaccine too. Because older kids, like our parents' age, our kids' age in their 20s, and we as grandparents have lost a lot of the immunity that we had to pertussis. We can pick that germ up very, very easily, especially in a daycare setting. We would get nothing more than a cough and not feel too bad, but we could spread it to young infants who are very, very susceptible. The name of the vaccine is called Boostrix or Adacel, A-D-A-C-E-L. Both of those vaccines should be available from internists and family practice doctors. It'll be a one-time shot only. So that's an important vaccine to get. Another vaccine that we give nowadays, this Hib vaccine, Haemophilus influenza type B. It's not actually influenza. It's a bacteria that, before this vaccine came out in 1986, was the #1 cause of meningitis in kids. Included with meningitis would be pneumonia, soft tissue infections, bone infections, and ear infections. Since that vaccine, well, I should say that it used to cause 20 to 25,000 cases of meningitis every year in the United States. And most of those cases occurred from November through March in what we used to call meningitis season. Since that vaccine has come out, that disease has nearly disappeared from North America. There's less than 200 cases of that every year now. Oops, just going to go back there. Rotavirus. This is a virus that is the #1 cause of vomiting and diarrhea in kids. All of us who have had kids, our kids went through this, and you probably remember it because it was horrible. It was the #1 reason why kids in America were admitted to hospitals for dehydration. And it accounted, unfortunately, for about 100 deaths per year in this country. But worldwide, 900,000 kids die every year of this virus. Since this vaccine came out 4 to 5 years ago, this virus also has nearly disappeared as a cause for us to admit kids to the hospital. It's a drink, too. It's not even a shot. And they only have to get it at 2 months and 4 months of age. So these vaccines are life-saving. Hepatitis B vaccine. This is the first vaccine that babies get. They get it usually within 12 hours of age. Influenza vaccine. It's something that all kids should get. And as caregivers, we all need to get that too if we're going to be taking care of our grandkids. Now you can get the influenza shot if you are less than, I think it's age 50. You can also get a nasal flu vaccine if you don't like the shot. And the nasal flu vaccine is very, very effective as well. The next subject that I'd like to talk about is safe sleep. In 1992, I remember making rounds at Methodist Hospital, and I was in a patient's room, and on Good Morning America, they had a new announcement from the Academy of Pediatrics about a new campaign called Back to Sleep that changed the old recommendation from babies all should be sleeping on their stomach to no longer should they sleep on their stomach, they should always sleep on their back. Literally overnight, it turned upside down everything that we had been taught as doctors and as parents about what we should do with our babies. And the evidence was compelling that children who slept on their stomach had a higher risk of sudden infant death than kids who did not. And of course, we all thought, what are these babies going to do when we put them on their back? They're going to choke, they're going to aspirate, they're going to get pneumonia. But that is not the case. We have not, since that time, 20 years ago, seen any increase in the number of cases of pneumonia or aspiration or anything like that. And yet the number of cases of SIDS has dropped from an average of 5,000 to 6,000 cases per year to less than half of that nowadays, mainly because of just that one simple maneuver. Now, there's many things that contribute to SIDS, and yet we still don't know the exact reason. But here are the most important things that we need to remember as grandparents when we're taking care of our infant and grandchildren. Back to sleep means always they sleep on their back. There's no exceptions to that. I would say the only exception would be if you were holding your child, your grandchild, on your chest, and you were awake, watching TV, reading a book, or talking to somebody. But you cannot let yourself fall asleep with your grandchild on your chest. And we have seen plenty of kids, or babies, who have fallen off their parents' chest and had a skull fracture or some other fracture, or who have been trapped in the couch or in the bed and suffocated because they were sleeping with the parent. So you cannot allow yourself to do that, and they must be sleeping on their back on a firm surface. Most mattresses nowadays are very firm, but a couch is not firm. A beanbag chair is not firm. A car seat is firm, but it is too enclosing for a baby to sleep in. So they should sleep on a firm mattress. And there should be no bumper pads, pillows, stuffed animals, blankets, anything else in that crib. It really looks quite Spartan. It's not like the picture of the baby cribs, you know, in the Sears catalog. You know, or it's not Sears catalog anymore, is it? Babies are us. But you want as much air circulation around the baby's head as possible. Second thing, or the third thing about that sleeping environment is that babies should be wrapped only in one more layer of clothing than what the adults in the house feel comfortable wearing. So here in the summertime, when it's hot, and our houses are air conditioned, but they're not necessarily cold, if we're comfortable wearing one t-shirt in the house, the baby should wear a t-shirt and one more layer over that. Now that might include a sleep sack and a t-shirt, but not a blanket. And we really do not want blankets in the crib anymore because of the risk of getting them up around their face or tossing and turning and getting them wrapped around their neck. And that's about that. And sleeping in the same room as the parents. That has been shown to be helpful and somewhat protective for babies in terms of risk factors for sudden infant death syndrome. So we do recommend that parents have babies in a bassinet next to their bed up until 6 months of age. That if the mom is nursing or if they're bottle feeding, they can reach over, grab the baby, pull it into bed, feed the baby, and then put it right back in the crib next to the bed again. And then the last thing is, this sounds kind of strange, pacifier use is beneficial. Now that's kind of comes full circle. Sometimes pacifiers are in, sometimes pacifiers are out. Right now, we would say pacifiers are in. However, we don't want to start them right away when babies are born. We'd rather have them get well established with breastfeeding first and then introduce pacifiers after that point. And it is not that if the pacifier falls out of the baby's mouth that you have to run in there and put it back in. For some reason, there is a protective factor that babies who use pacifiers, it helps protect their airway, even if it falls out of their mouth if they're used to using it. So that's a reasonable thing to be doing as well. Car seats. The number one most important development in child safety in the last 30 years has been development of car seats. And before most of you got here tonight, we were talking about the first time when we had babies and how did we put them in the car? We jammed a crib in the back seat and put it in there tight, put all kinds of pillows and blankets in there so that the baby wouldn't roll around, and we drove with that. Or we had these brand new buckets that came out, I think, in 1977 or 78 or something, that you could strap into the car that weren't very safe, but they seemed safer than just holding the baby in the car. But it wasn't until 1978 that the first state in the Union, and that was Tennessee, required car seats for infants. And it wasn't until 1985 that all states in our country required the use of car seats. I think we all use them now. I think we're all familiar with how to use them. But to me, the most important new development with car seats in infants is that all babies less than 2 years of age ride rear-facing in the car. Now that rule changed just a couple of years ago. It used to be up until 1 year of age and 20 pounds. Then you could turn kids forward-facing. But what the research showed was that babies who are forward-facing and are in a collision had a 500% increased risk of injury or death if they were in a forward-facing car seat as opposed to a rear-facing car seat. But wait till mine goes off. And in Sweden, which does a lot of the research for infant car seat safety, kids ride rear-facing until they're 4 years of age. And they have almost 0 fatalities in that country regarding car seats. As kids move up the chain of car seat protection, when they get to be 2 years of age or when they have outgrown the requirements for the car seat that they're in, and those requirements should be printed on the car seat itself, then they can move to a forward-facing car seat. And usually those car seats are good up until about 60 to 65 pounds. Now, a couple of weeks ago, there was some new information that came out that said, or brought up a concern about the latch system in our cars that you attach the car seats to. And I haven't read anything new about this since that time, but we've always been saying the weight of the child was the key factor. But this new study indicated that maybe latches will fail if the combined weight of the child in the car seat and the car seat itself are 60 or 65 pounds. So that may be a new thing to kind of consider if you have a child who weighs, 45 pounds or 50 pounds, and I don't know what car seats weigh. But if they weigh 10 pounds, 15 pounds, then you might have to move them out of that kind of a car seat sooner and into a booster seat. Booster seats are indicated for most kids up at least until age 8 and maybe even age 12, until they're 4 feet 9 inches tall and about 80 pounds. When kids sit in a regular back seat, they should be able to sit upright with their legs crossed right where the seat drops down and not sticking out. And the cross belt, chest belt, should come across their chest here and not having to tuck it underneath their arm or have it go across their face. Okay. All right. Cough medicines. How many folks here have cough medicines at home for their kids right now or the grandkids? Well, that's very good. Everybody's up to date here then. But I can remember prescribing cough medicines for kids as young as 4 to 6 months of age. And they were all out in the market, they were all available, and we all thought they were very, very safe. And yet I can still remember in residency being told in pharmacology class that there was no evidence that cough medicines helped infants. But yet when we were all taught in clinics, we're all told, yes, you need to use cough medicines or you'll be hounded all night long from parents calling you about how to stop this cough. We, I would say it was 3 years ago, 4 years ago, they finally took cough medicines off the market for kids less than 4 years of age. It wasn't so much that cough medicines were dangerous in the doses that were being prescribed, but it was that kids were being overdosed by multiple products that would contain cough medicines and Tylenol or Advil, or that multiple parents or caregivers were giving kids cough medicines throughout the day. Those then led to problems. So nowadays, we do not recommend any type of cough medicines for kids less than 4 years of age. What can you do for babies that are coughing? Number one, plenty of fluids. Water is best. When a baby is coughing, just holding them upright in your arms and having the water bottle there that they can take frequent sips, or just a cup of water with a straw. Vicks on their chest. Vicks mentholatum, old-fashioned treatment. Study came out last November in the pediatrics journal that we use that compared Vicks to Vaseline to see if there was any clinical benefit from it. And indeed, the kids who had Vicks on their chest, not on their nose or on their face at all, Vicks on their chest, had less cough, and their parents and grandparents slept much better. Humidifiers. And there's many types of humidifiers on the market right now. And there's cold ones, there's warm ones, there's ultrasonic ones. It doesn't make a lot of difference, except that steam ones we generally would not recommend because of the risk of burning. Now, I personally like steam ones in the wintertime when it's cold outside, but the risk is that a child might trip on it or play with it or get burned on it. So we generally don't recommend steam vaporizers for the wintertime. And then the last thing that you could use for cough, there's antihistamines are still approved for use in kids down to 6 months of age. Sometimes antihistamines can help dry up secretions that are stimulating the cough reflex. The downside of antihistamines like Benadryl and Zyrtec and Claritin is that they may thicken those secretions and make them harder to get up from the child, and that might make them more susceptible to other complications like pneumonia. And so this is my last slide. And it basically is just a reiteration of what we have talked about here tonight, that as grandparents, it's fun to have our kids over, our grandkids over, play with them and do all the fun things. But we have to keep in mind that what we do when the grandkids are at our house has to be consistent, I think, with what the parents are doing. Their discipline techniques have to be brought over to our house. Their diet plans have to be brought to our house. And the limits and timeouts and things like that are in their homes have to be the same as what we do at our place. It can't be different. So with that, I will open it up to questions. Whoa, you were first back there.
About the whooping cough shot.
Yes.
Now, my daughter will have the baby in October.
Okay.
So if I got it, then someone said I need to stay away from her for a couple of weeks.
Not true.
Not true.
There's nothing live in the vaccine. You can get it now.
How about, I've been thinking about getting a shingles shot as well, and they told me you can't be by them if you have that either. Is that?
Well, the Zostavax, I believe, is what you're talking about. It's indicated for people age 60 and above. It's probably, we don't give that in pediatrics. I think it's a live virus vaccine, and there's the potential that something like that could cross, but so is the varicella vaccine that we give to babies. We don't restrict any kind of activity with that. So if you want to get them right now, that'd be perfect. Okay.
And then when you talked about the pacifier, were you also, you said it helps keep the airways open. So were you talking about having it through the night even?
Yeah, and see, that's what drives parents crazy, is because the pacifier pops out then real quick. And it seems like it's a very, very strange phenomena that's been noticed in the research, that the pacifier doesn't have to be in the mouth to have a protective effect. But they have to use it during the daytime. They have to have that effect. So it's something about pacifier use. Now, you don't want to be shoving a pacifier in a baby's mouth all the time either. You want to use it judiciously if they seem like they need it. Some kids do need it more than others. Okay. Soothe brand pacifiers are the ones we like to use too. They have a hollow point nipple on them. They don't have any other joints on them or anything like that to collect bacteria. Soothe, S-O-O-T-H-I-E, what?
When should the pacifier go away?
Well, we would normally say at a year of age, or even at 9 months of age, that you would try to restrict the pacifier use to the bedtime only. And certainly by age 3, you would try to get rid of it and give it to the pacifier fairy. Okay? Okay. Shirley?
You were talking a little bit about timeout. What is the new theory on timeout? How early? That kind of thing.
I don't know that there is a certain age that you can start that. But certainly when this child starts to show free will, I think you should start timeout. Now that might be as early as 15 months to 18 months. They're not going to understand the concept of going and sitting in a corner though, and sitting there for 1 or 2 minutes and that type of thing. But when a child does something that you want to, they don't know that they're doing something wrong. But if it's an activity that you do not want them to repeat, you simply say stop, give them the mom look or the dad look, and then pick them up and move them to another area, just 5 or 10 feet away, and walk away from them. Most kids will look at you like, what was that all about, right? But you don't want to yell at them or hit them, because then they'll get the idea that that's okay to do. And if you're bigger and stronger and louder, you get what you want. But when you move them back like that, they will repeat that activity over and over and over again. And you just have to be persistent and keep saying, stop, don't touch. If it's a light socket, you might go up to the light socket and say, don't touch the light socket. And then keep moving them away. And eventually they're going to walk up to it and stare at it, put their hand like that, and look at you. Not like, what are you going to do about it? But rather, is this the right thing? And that's when you go up to them and you say, Johnny, good boy, and give them a hug and then walk away. Because that kind of positive reinforcement is a stronger teaching tool than anything from a negative standpoint. Certainly spanking gets results short term, but it also has other negative consequences that in the long term probably aren't good. So timeout, I think, is effective. But if you're doing it more than 3 or 4 times a week, you're probably doing it too much. Okay. Good question so far. Yes?
About timeouts for your older children, say 11?
Until what age?
11.
Gets a lot tougher then, doesn't it? And especially when they can talk back. And I think it's important that when kids get older, that you try to set ground rules ahead of time for expected behavior. Because depending on what kind of day we're having, we might come up with all kinds of rules and things that we want our kids to do or not do. And if we blindside them with new rules or new restrictions, they're going to get upset by that. So I think it's good to have the 10 commandments for how to get along in our house, first of all. And so that they know those and you give them a warning. Okay? And if you cannot physically make an 11-year-old go and sit in the chair, there has to be a loss of some other type of privilege in the meantime. And they have to know what those consequences are going to be ahead of time. Yes?
Does thumb sucking equate with what the pacifier does?
Yes, probably. That's the easy answer, isn't it?
I was wondering, we're talking about sleeping on the back. Is there a time frame that we're looking at here?
Very good, thanks. The highest incidence of sudden infant death syndrome is the first 1 to 3 months of life. Cases have been reported up until 9 or 12 months of life as well. But what the guidelines talk about is back sleeping position at least until 6 months of age. Now, at 4 months of age, kids can start rolling over from their back onto their stomach. And then the guidelines say it's okay if a baby is doing that on their own, as long as there's nothing else in the crib that can cause an obstruction. So that's why you don't want stuffed animals and pillows and blankets and things like that in the crib itself. And you want that firm sleeping surface. Okay. Danny, are you here? Okay. So how many, everybody here a grandparent? Now you, soon to be? Soon to be, okay. What? Uncle? Oh, very good. It's when you first find out you're going to be a grandparent, it's sometimes not the greatest feeling in the world. But I would tell you that after they get here, it's amazing. And it is, in many cases, a lot more fun than having your own kids, because you don't worry quite as much about everything, but you enjoy everything, I think, a lot more. And you can also be more of a parent to your own kids that way, too, and reassuring to them. And it's gratifying to see your own children become parents as well. So I would encourage you all, when you can, to go in to the pediatrician's office for the well baby checks. And because we talk about a lot of these subjects at that time as well. So you'll get to hear the same thing that your kids are hearing. Yes?
I have a concern. My daughter and her husband have 2 cats. And I am really concerned about them.
In terms of?
Well, they're large cats, and they actually tend to be kind of jealous and not even like when other people come over. And so I don't know how they're going to accept the baby. And then I worry about at night if they were to try to get in the crib or anything like that.
These kind of things, can keep you awake at night worrying about these things. But I don't know of any case, and if anybody else knows that, let me know, please. But I know of no case of an infant suffocating because of a cat or a dog or a pet that jumped up into the crib itself. Now, I don't think it's a bad idea to try to restrict the pet from the baby's room. I think that's wise. But you can't restrict, if it's a pet that they've had for a long time, you're not going to be able to keep it in the basement or the garage all the time. So I would simply say keep the bedroom off limits for the cat or dog.
They had talked about this, but then they changed their mind, putting a screen door instead of a regular door.
I've heard that done before. I don't think that's such a bad idea either. You can certainly hear everything that's going on in there too. And that way, keeping the door shut is not going to let the cat, get into the room, and you can still hear what's going on. I don't know how easy that would be to do, though. Are any of you watching or living with your grandkids or raising them?
Well, we do overnights because the parents work overnight.
Mm-hmm. So this sleeping issue is a very important one for you.
The 6 a.m. waking up, that's a killer to me. I'm not used to that on a weekend.
It was easier when you were younger, though, wasn't it? See? It's very tough. The baby that wakes up, if they have slept 6 hours to 8 hours already and they wake up at 6 a.m., there's not much that you can do about that. And it's pretty noisy at that time of day anyway. So, all right. Well, I don't have anything else to talk about tonight. And if there's no other questions, then we could call it good, okay? All right. Oh.
I have grandchildren like this, and I watch them all day, every day during the summer. They're 6 to 12. So do you have classes that would, because they're a handful, the boys especially, they just, you know, at each other all the time, which as they say, boys are that way, but
Yeah, do you live in an apartment or a house? House? So you have a yard also that they could play in? And I would start looking at activities and games that they could play in that backyard without breaking windows and, you know.
oh yeah, they
having
do
a-
that, and then about 5 minutes later, they're at each other again, so it's like, okay. Is there classes for this?
I do not know that there's any classes, but I'm sure you keep searching on Google, you know, you'll find something.
For me, I don't know, you know.
That's a big job, you know, for you to take on yourself. And I think that if you found an activity that they showed an interest in, I mean, maybe that could be a field trip once or twice a week. Maybe they have an interest in making cookies or some other kind of thing. You could do cooking too. And then you could play other activities outside. And you could have each week one of those kids is the leader and they pick the things to do that week, and the next week the other one gets to pick all the activities, you know, to do. So they kind of share in all those things. So it's not always competition. Okay. Very good. It's nice to see some familiar faces in the audience tonight. And I hope to see you in the office then soon sometime, okay? All right. Good night.